जीवन हमें एक मौका देता है, इसलिए जब भी सही कॉलेज चुनने का समय आए तो सिर्फ मंगलायतन यूनिवर्सिटी आपके बेहतरीन भविष्य और सर्वांगीण विकास के लिए।
Significant layoffs are underway in the United States Health and Human Services Department. These cuts come as a part of an extensive restructuring plan aimed at streamlining the department's operations. Workers from across the US Health and Human Services Department are receiving layoff notices as a part of a controversial overhaul by Donald Trump administration. The move is expected to eliminate thousands of jobs. The restructuring is being led by Health Secretary Robert F. Kennedy, who argues that the department's massive size has led to inefficiencies. This overhaul affects key health agencies that play pivotal roles in research, disease tracking, and public health safety. Among those impacted are the National Health Institutes of Health, the Food and Drug Administration, and the Centers for Disease Control and Prevention.
Our department is filled for the most part with competent, conscientious public servants, and yet the agency has been inefficient as a whole. Over the past 4 years during the Biden administration, HHS's budget increased by 38% and its staffing increased by 17%, but all that money has failed to improve the health of Americans. In fact, the rate of chronic disease and cancer increased dramatically as our department has grown. When I arrived, I found that over half of our employees don't even come to work. HHS has more than 100 communications offices and more than 40 IT departments and dozens of procurement offices and 9 HR departments. In many cases, they don't even talk to each other. In Trump's DOGE workforce reduction initiative, we're going to streamline HHS to make our agency more efficient and more effective. We're going to imbue the agency with a clear sense of mission to radically improve the health of Americans and to improve agency morale. We're going to eliminate an entire alphabet soup of departments and agencies while preserving their core functions by merging them into a new organization called the Administration for a Healthy America, or AHA.
The layoffs, combined with funding cuts at state and local levels, are expected to ripple across the nation. Health officials are already warning the effects will be felt across communities, especially in public health and emergency response efforts. Let's understand what really is happening. As per Associated Press, researchers, scientists, doctors, support staff, and senior directors of the Public Health Department are being laid off. Many employees started getting termination mails in their inbox as early as 5 a.m. in the morning, while many found out that they have been terminated after they stood in long lines outside their offices just to find out their access card or badges don't even work anymore because they have been laid off. As per the Associated Press, some employees who were placed on leave were offered possible transfer from Washington to all the way to Alaska. Not just this, a department that handled freedom of information request was also shut. Programs that focused on fighting HIV and hepatitis were also eliminated. Teams that regulate drugs, food, medical services, and tobacco products also received termination notices. Meanwhile, lawmakers have voiced strong opposition to the plan. Some fear these cuts will ultimately undermine efforts to protect public health and safety. As the future of United States health agencies becomes uncertain, many wonder, how will this restructuring impact government's ability to respond to nation's health challenges?